Should I worry about antibiotic side effects in ear infection treatment? When your child has an ear infection, it's natural to wonder if giving antibiotics might cause problems. Antibiotics can be very helpful in fighting bacterial ear infections, but they also come with some risks of side effects. Most ear infections in children tend to get better on their own without antibiotics, especially if the infection is mild or if your child is over 2 years old. In these cases, the benefit of antibiotics might be small, and the risks could outweigh the benefits. When antibiotics are used, they work by killing bacteria that cause the infection, but they also affect good bacteria in the gut and mouth. This can lead to side effects like diarrhea, which occurs in about 5 to 10 children out of every 100 treated. Some children may develop a rash, which can happen in about 3 to 10 out of 100 cases. Oral thrush, a yeast infection in the mouth, is another possible side effect. Antibiotic ear drops can sometimes cause itching or discomfort in the ear itself. Because of these potential side effects, many healthcare providers now recommend a wait-and-see approach for mild ear infections, especially in children older than 2. This means waiting 2 to 3 days to see if symptoms improve on their own before starting antibiotics. If the child's symptoms get worse or do not improve during that time, antibiotics can then be prescribed. This approach helps reduce unnecessary antibiotic use and minimizes side effects while still treating infections that need it. Shorter courses of antibiotics, usually 5 to 7 days instead of 10, are often enough for many children with ear infections that are not severe. Using a shorter course can lower the chance of side effects without reducing the treatment's effectiveness. The first choice of antibiotic is usually amoxicillin, which is effective for most uncomplicated ear infections. Using the right antibiotic helps avoid unnecessary exposure to broader spectrum medicines that may cause more side effects and cost more. It's also important to note that giving multiple courses of antibiotics early in life might increase the risk of developing conditions like asthma, allergies, or eczema. So, healthcare providers carefully consider whether antibiotics are truly needed, especially for very young children. In summary, while antibiotics are important for certain ear infections, they can cause side effects that are common enough to think about carefully. Parents should talk with their child's healthcare provider about whether antibiotics are necessary. When appropriate, watchful waiting can be a good option. Always follow the doctor's advice and use antibiotics exactly as prescribed. This way, you can help your child recover safely while minimizing the chance of side effects. Remember, every child is different, so personalized medical advice is always best.